Diabetes, high cholesterol, high blood pressure, these can all be related to PAD. That's a type of vascular disease that, if left untreated, can lead to heart attack, stroke, or death. I went to Modern Heart and Vascular Institute in Humble, where Dr. Rajiv Agarwal shared the treatment options for PAD and the importance of early diagnosis. Dr. Agarwal, obviously vascular health is something that we all should be aware of at any given time. It keeps us moving, but especially as we get older, there are some things that we have to keep in mind.
Absolutely, Deborah. Vascular health is very important. People realize that they have symptoms in the chest. They come in for checkups, but leg symptoms usually you don't even get until it's the later stages.
Yeah.
So the earlier people get screened for vascular health, the better it is.
All right, peripheral artery disease. What is it? What causes it?
So peripheral arterial disease, the word peripheral means that it's away from the heart. It's farther out. Arterial disease is just disease of the arteries. So we're talking about blockages, usually in the legs, but it could be anywhere in the body.
All right, who's at risk?
The people that are at risk are the ones that have traditional risk factors like diabetes, high cholesterol, especially smokers. People that smoke have much higher incidence of having peripheral arterial disease. And then people that are obese and don't take care of themselves.
And then of course that thing that always pops up with almost every disease, aging.
Yes, the older we are, yes, you get hardening of the arteries, you get calcium buildup in the arteries, and you develop PAD.
All right, are there preventive measures that we can take?
Yes, so the main one is to quit smoking or to not start smoking, but once you have it, the first thing to prevent is to screen yourself. So people that have any symptoms or have risk factors such as smoking or diabetes should be screened, and that's how you prevent by catching it early.
Yeah, because, and speaking of catching it early, as you mentioned, a lot of people don't have those symptoms until it's much too late. So if you are having symptoms, and let's go through some of those, by that time it's advanced.
Yes, so the typical symptoms are symptoms in the legs with exertion. So if you have symptoms at rest, it might be more venous disease, but if you have symptoms with exertion, it's way more likely to be PAD or peripheral arterial disease.
So hard time walking long distances?
Yes. And the other symptom that people don't pay attention to is if they have hair loss or if they have erectile dysfunction. Those can be signs of peripheral arterial disease as well.
All right, how do we treat it? And I would imagine it depends on how advanced it is.
Yes, there are options. So first we talk to our patients, we examine their legs, and then get an ultrasound. And if it confirms that they have PAD, then we start the treatment with medications, or sometimes as aggressive as opening up the blood vessel with roto-rooter, stenting, balloon angioplasty. But all of these are simple, non-invasive, non-interventional treatments that can be done as an outpatient basis. You come in, you get it fixed, you go home the same day.
Wow, and get the problem taken care of. Now, here's the thing that we need to do. We need to convince ourselves that, because oftentimes we come in when we just can't keep going, right? But we need to go ahead and get screened first. Like you said, it's really easy to screen. If there's not a problem, go on about your life, right? But if there is, there are things that can be done to head off a worse situation.
Absolutely, you have to screen. Screening is very important. Just like a car cannot run without 4 adequate tires, your body needs healthy legs to be able to function properly. And screening is the key, just like for heart disease or leg disease, you gotta get yourself screened.
Okay, I know I can hear some of my friends now. I have a couple of hypochondriacs who are like, they're 23. Oh, I need to get in. So in general, who needs to screen?
I would say over the age of 40 to 50. And those people that have the 2 most common risk factors being smoking and diabetics. So symptoms, diabetes, smoking, any of those 3, you should get screened.
For sure, but if you're having any other kind of symptoms, better be safe than sorry.
Absolutely.
And you can eliminate things or take care of things, as we said.
Yes, and PAD is usually a first sign of disease happening elsewhere as well. So the earlier you screen for PAD, you may be able to find out if you have other blockages in other locations too.
Dr. Agarwal, thank you very much.
Thank you, Deborah.
To book an appointment with a board-certified cardiologist, visit Modern Heart online at modernheartandvascular.com or give them a call. Here's the number, 832-644-8930. Again, that is 832-644-8930. Appointments fill up fast, so contact them today. By the way, they have doctors who are fluent in Spanish. Also, their new Woodlands location is now open.